In what is shaping up to be one of the most heartbreaking healthcare scandals in recent memory, 24 newborn babies have died at Victoria Jubilee Hospital, VJH, since June, and the silence from authorities has been deafening. While grieving parents wait for answers, Jamaica is demanding truth. The only thing filling the void left by these infant lives is outrage and sorrow. What actually happened at VJH? Since the beginning of June, 24 newborn babies tragically died at Victoria Jubilee Hospital, Jamaica's largest maternity facility. The Ministry of Health says all the deaths were due to complications from prematurity, but critics and the public are pushing back hard. Here's what we know. Most of the infants were born prematurely and required specialized neonatal care, incubators, ventilators, oxygen support. According to health officials, these babies succumbed to natural complications associated with early births. But there was no public disclosure until the numbers began leaking, prompting national outrage. Dr. Alfred Dawes, opposition spokesperson on health, called the explanation inadequate and irresponsible, noting that premature babies don't die simply because they're premature. They die when hospitals lack the tools and staff to keep them alive. This is a systems failure, not a natural disaster, Dawes said. A premature baby in Canada or Barbados has a better chance of survival than one at Jubilee. The public is also alarmed by the ministry's lack of transparency. There's been no full timeline of events, no autopsy reports released, and no independent audit of hospital conditions. For many, this feels like another silent crisis, swept under the rug. And it's not the first time. In 2015, 18 babies died at the same hospital in what was later revealed to be a bacterial outbreak, something the ministry initially downplayed. Opposition health spokesman Dr. Alfred Dawes has described this as more than a tragedy. It's a full-blown public health crisis. He stated, "Prematurity is not a sufficient explanation. It is failure of systems, infrastructure, staffing, and leadership." He highlighted an alarming backdrop: 229 neonatal deaths at Jubilee from October 2023 to June 2025. And now, 24 more in just 1 month. He has demanded full data disclosure dating back to 2020, saying, "If we don't even know how many babies have died, how can we fix this? Transparency is not optional, it's essential." Dr. Dawes also warned that Jamaica's maternal mortality rate is now higher than it was 30 years ago, calling this a public health system in crisis. A broken system unveiled. VJH is the largest maternity hospital in the English-speaking Caribbean. If such a tragedy can happen here, what does that say about the rest of Jamaica's health infrastructure? This isn't an isolated incident. Preventable infections should never claim so many lives in one facility. Instead of a swift emergency response, we're met with hush and delay. Dr. Dawes' criticism isn't just valid, it's essential. Who is being held accountable? Minus Dr. Dawes and advocacy groups are demanding a complete public investigation into the neonatal facility at VJH, the release of neonatal mortality data from 2020 to 2025, immediate resignations or accountability if negligence is proven. So far, nothing. No transparent investigations, no ministerial accountability, no reforms. Why this must matter to you? We are all grieving alongside these families, and yet the government watched it unfold in silence. If 24 babies perished in 1 month at our flagship hospital, how long can the rest of Jamaica's public health system remain ignored? Time for a crisis response. Provide public disclosure of hospital mortality stats. Launch an independent probe into staffing, sanitation, equipment, and protocol failures. Fund emergency upgrades to neonatal health facilities. Implement strict, enforceable hygiene and staffing standards. We demand answers. We demand action. If 24 babies can die within the walls of our biggest maternity hospital, what's next? This isn't just about mourning. It's about accountability. It's about change. It's about whether Jamaica values its most vulnerable citizens. Voice your outrage below. Share this video. Make sure voices are heard nationwide. Subscribe for full coverage on this developing crisis.